Hi, my name is Elizabeth. The purpose of this picture is to identify the bones of the cranium and the sutures. This is a lateral view. Here is the frontal bone. Connected to the frontal bone is the coronal suture and the spinal bone, the zygomatic bone, the nasal bone, and the maxilla bone. The next bone that's connected to the frontal bone is the parietal bone, the temporal bone, the occipital bone. Here you can see the lambdoid suture, the squamous suture. You can see the mastoid process and the external acoustic meatus. This is the mandible bone. The mandible bone is the only movable bone of the skull. In the next picture, we will be looking from a superior view. The occipital bone, you can see the lambdoid suture. The parietal bone is split in two, it's two bones, and it has a sagittal suture. The frontal bone, the coronal suture, and you can see the nasal bone. In the next picture, I will identify the sinus. You have the frontal sinus, the ethmoid sinus, the maxillary sinus, and the sphenoid sinus. Take a moment and let's press for the frontal sinus, ethmoid sinus, sphenoid sinus, and the maxillary sinus. In the next picture is just to identify the palate of the maxillary. This is the hard palate area and the soft palate. Here is the foramen area. It's called the incisive foramen. This is the typical area that a dentist will numb the gums for the top of the teeth area, the gums. This next photo is just the purpose to identify the uvula of the oral cavity. Here is the uvula, this is the soft palate, and this is the hard palate. In the next one, on the face, I'm going to identify the landmarks. This is the forehead, which is called the glabella, the nasion, the orbital area, the inner canthus, outer canthus, temporals, your cheeks, which is the zygomatic, the septum, which is the external nose, your anterior nares, your phylotrum, the ala, your chin, which is the mental protuberance, and the angle of the mandible, your exterior ear, which is the tragus. Thank you for watching.